Hi, welcome to my channel. Today I'm going to talk about ECGs. In short, in cardiology, ECG is the first step we generally take to diagnose a patient's condition depending on what he's complaining. And based on the ECG findings and the history we get, we move further in ordering different tests, or we pause there and start treating the condition. One condition, or rather 3-4 conditions where ECG is diagnostic immediately is heart attack, rhythm problems like ventricular tachycardia, atrial fibrillation, and very slow heart rate, which is called complete heart block, which will need a pacemaker. In these, they're absolutely diagnostic and we can come straight to the treatment plan. ECGs are electrocardiogram records of the waves that are generated in the heart. So ECG records the electrical activity of the heart. Electrical activity of the heart basically is a conduction system of how the heart initiates contraction of different chambers and how this activation spreads all along the heart, making the heart an efficient pump which works at a range of rates. So generally it works between 60 to 100. And if the need arises, the conduction system can increase this heart rate as per activity of the patient or reduce the activity as per the resting status of the patient. So it controls the heart rate of the patient. ECG is used for multiple conditions to diagnose ongoing heart attacks or myocardial infarction. It can diagnose unstable angina or acute coronary syndrome. These are conditions which are precursor to developing a heart attack. It can diagnose rhythm problems where the heart rates become irregular, which is commonly heard by many people as atrial fibrillation. It can also detect life-threatening rhythm conduction problems like ventricular tachycardia or ventricular fibrillation. And besides this, it helps in diagnosing whether any chamber of the heart is become larger or it is small. What is the effect of blood pressure on the heart? It also helps in diagnosing heart disease in children based on the axis, the loops, and the chamber dilatation. ECG was invented in 1902 by a Dutch scientist by the name Einthoven. The ECG started with a basic, simple ECG, which has evolved into using multiple ways of diagnosing heart diseases. So we have ECGs which have different kinds of leads placed at different positions, and we also have different ECGs which measures heart rate variability and assesses the risk of problems in a patient based on these ECG findings. So a normal ECG does not mean that the patient is not having a problem. A normal ECG at the moment when it is taken just tells you at that present moment the electrical activity of that person is normal. So ECG alone is not sufficient to diagnose heart disease. You need other measures like history and other blood parameters and other tests like 2D echo to come to diagnosis of a particular problem. But yes, when you have an abnormal ECG, it's almost diagnostic of the condition that is seen on the ECG. If you like this video, feel free to like and subscribe. See you until next time.